I'm Erika Olmedo, and I've been a pediatric speech-language pathologist since 2001. Here's what you should know if you're having a speech and language evaluation for your child. A good speech and language evaluation must be thorough and comprehensive and needs to make you feel confident that the results are accurate. During my assessment, I first asked the parents to fill out a case history questionnaire and consent forms. Once completed, I interviewed them to better understand their concerns and learn about the child's history, starting at pregnancy. After that, I conduct a clinical observation during a free play activity with either the parents or siblings. And if possible, I will do a second clinical observation at school or daycare center. The goal is to assess the language potential of that child in different contexts. This is where I gather information regarding the child's ability to communicate spontaneously and with those who he or she is most comfortable with. With the parent's permission, I'll record those interactions and later transcribe the child's utterances. This is called a spontaneous language sample. I then narrow down my investigation. So by then, I will know which test is most appropriate based on the focus of the problem. If the focus is on the speech area, I'll use tests to check for possible speech articulation and phonological disorders, childhood apraxia of speech, stuttering, voice disorders, and oral motor issues. If the focus is on language, I'll use tests that look at the level of language comprehension and expression in terms of vocabulary, grammar, and social pragmatic skills. A standardized test in the area of language will indicate the child's level of language comprehension and expression as compared to children his or her age. Schools often require the scores of a standardized test in order to qualify the child for special education services, and in the case of insurance, to cover speech therapy services. At the end of this investigation, I'll write a report and sit down with the parents to relay the results. When I hear parents say, "That's my child," I know I did my job. Sign up to receive a resource information geared toward your area of concern. And if your child is between 9 and 30 months of age, I will send a link to a free screening. Thank you and be well.